I would remove the regulatory barriers to providing adequate care. Why aren't we spending resources on analytics to really understand the health of the industry, the moves that have been made so far, and how they've impacted them? What happens when they want to try? How do we educate those people?
Right.
We have a whole bunch of people who are afraid to smoke because of jobs. We don't have protections.
We don't have protections on jobs.
She led critical care nursing teams and spent years brushing off campus as taboo. Then, postpartum stress had her sneaking late-night tokes while the house slept. Today, her pastor mom keeps her calming topical on the nightstand. I'm Jay Sriposa, host of High Functioning. After decades of scaling tech and cannabis ventures, I sit down with operators who show growth is possible without burnout or secrecy. My guest is Dru Ledbetter, former director of critical care, Afro-Latina co-founder of Zen Boutique, and creator of the Rapid Change Framework. She helps professionals drop fear, reset their nervous systems, and use plant medicine with purpose. We'll unpack conversations that turned a skeptic bomb into a believer, the gauntlet of Boston licensing, and what healthcare still misses about cannabis.
I think it's going to take education on every angle to really tackle this, because we not only have to educate the providers, we have to educate the whole system that interacts with the providers.
This is ambition without burnout and without outdated bias. Let's dive in.
I am a Druidess. I am a mother. I am an author. I'm an entrepreneur. I'm a speaker. I'm a coach. I'm a friend. I think I'm a lot of things. I'm a woman, and an Afro-Latina woman at that. Living in the United States, just helping people define their own wellness journeys.
So when you talk about, like, there's a lot in there, obviously we can cover, but like Afro-Latina, right? Is that like, do you carry these definitions around with you sometimes just because, or do you always have that presence of mind when you're talking to people? Or are you kind of just like...
That's a good one, Jason. You're starting good.
Oh, sorry.
So, no, because Afro-Latina is a thing that is kind of, it's like new. It's like hip now.
Right.
When I was 9 years old and came here from South America, I was just black that spoke Spanish. I wasn't Afro-Latina, you know what I'm saying?
Right.
So I had like that identity crisis of looking like one population and only speaking the language of another. And I'm always grateful for the bilingual school programs in Boston because it helped me kind of immerse. And I was blessed and lucky enough to have an Afro-Latina fourth grade teacher. My first teacher was a woman that looked like me and spoke Spanish. So it was like a good transition for me. But as I went on, I had to learn the presence of being a black woman and understand what comes with being a black woman in America, and also find a way to honor my heritage, my language, my cultures. So there's been a lot of like the dancing and figure out your identity when you don't look the part. and I now have a very intentional presence about it because I understand that as we are defining Afro-Latinos, some people still haven't figured out what it means. Does it mean you're from an island? Does it mean you have African descent?
Right.
Does it mean one of your parents is browner than the other? Like, there's a lot of mixing of the language and trying to identify ourselves within the Hispanic culture that I try to be present and know that I'm a black woman and know that I'm a Latina and be proud of both.
Right. You can be proud of both. Exactly.
Yeah.
Because I find that it's like America is such a melting pot. There's so much diversity, depending where you are, of course. There's obviously limited diversity in certain areas. But I remember, we were just talking offline about New York. I remember being in Brooklyn and seeing so much diversity all the time, and loved that my kids were always just around this. Yeah. And like I was telling you, there's a Caribbean Day parade that would happen all the time on, I think it was Franklin Avenue. And we'd go see it every year. And it was just everybody, it was like colorful. It was like very colorful costumes and music, and everybody's dancing and having fun. Yeah. It's a beautiful scene. But it's funny because it's like, I feel like, and I'm not trying to necessarily like 100% say I'm like that, but I also struggle with identity things because my mother's Hispanic. She's from Honduras. My father's from Somerville. Somerville. But he's Portuguese and Irish, right? Yeah. So his mom was from Ireland all the way through Nova Scotia and Scottish and Irish and all this other stuff. His grandfather was had a schooner in the Gloucester Bay, right? And on his mother's side, my grandmother, I mean, my grandfather, it was Portuguese. And so they came through like New Bedford and the whole thing and the Azores. And so it's I'm like literally a melting pot myself, right?
Correct.
And I don't speak Spanish, right? Which is a shame. A lot of my relatives have said that to me. They're like, that's a shame.
Oh, they will. They will.
They'll call it out.
When you were like, I'm not easily offended. I'm Hispanic. Like that, you can't.
No, because they jump on me and they're like,
Yeah.
how'd you never learn? And I'm just like, well, I mean, I don't know. Just the way I grew up, you know?
Yeah.
But I have a lot of Hispanic relatives. I also have a lot of relatives still in Honduras, you know? And so it's interesting to kind of like see both cultures. And I've been there a couple of times just to like visit with them. But it's hard because growing up in a predominantly white area of Tewksbury, Massachusetts, it was like, what am I? Because I'd be like this Hispanic kid sometimes, and other kid, I'd be like, sometimes I'm just white, like everybody else. Like, it was such a weird kind of situation.
Yeah.
I didn't have a box to fit in necessarily.
Correct.
And even if I was in a box, I don't know if I would have accepted it, you know, when I was younger. Either,
Correct.
right?
Yeah.
So it's hard. But like you embracing it now,
Yeah.
I think is super special, right? It's like, so when did you move here?
I moved when I was 9.
When you were 9.
Yeah.
So you were fluent in Spanish, obviously. Before
I was,
that.
I was in 3rd grade. My last grade I completed in Venezuela. I was 3rd. I came to the United States into 4th grade. I know. And then 7th grade, I ended up in at the Boston Latin School. So in 3 years, learned English, became top of the class, ended up at one of the best high schools in Massachusetts. And it really, that identity and all those experiences through those grades really carried me to figure out and to land somewhere where I was safe to learn how to be myself,
Right.
which is one school consistently. I was there 6+ years.
Did you find yourself trying to conform to what was around you and trying to be like other people for a long time?
This is the hard. I could never, and that's why I always felt awkward, because even if I tried, I've tried to pretend and perform the part, I just couldn't.
Right.
I've always been like a geek. I've always been like awkward and clumsy, hence the boot. I've always been funny, and I've just been this mix of all things.
Right.
So I didn't fit, period. I didn't fit my family. I didn't fit in school. I was just like, okay, let's just find our circle.
Right. Do your thing.
And do your thing, yeah.
Yeah. So obviously you moved here, you went through the school system, learned English, and then you decided at what point to become, I think it was a nurse?
Yeah, I'm a nurse.
Yeah.
Yeah. So this is a funny story because you assume if you're of Caribbean descent, because my parents are Haitian, so that's your career choice, nursing. That's what you do.
Oh, okay.
So
that's inherent in the
there's so many, it's almost like it's a
Haitian
joke.
nurses.
It's it's a cultural joke that we tell, oh, you're a nurse, you're Haitian. That makes sense. It adds up.
Right.
Most families have a bunch of nurses. I wanted to be a politician and a lawyer.
Oh.
I was class president. I thought I was going to be the first Black woman mayor of Boston. And I was all in politics. And my sister was at Boston College, and she had been doing the nursing program and then switched. And she said, you should just become a nurse because it doesn't matter what degree you have in undergrad. You can go to law school no matter what. And at least you'll have a good job while you're in law school. And then I fell in love with nursing.
Oh.
Yeah, I know.
Yeah.
I know.
Nursing is so hard, though, right? The
well,
hours and everything you
yeah.
have to put into it. It's a lot.
It is a lot.
Yeah.
It's a lot because we forget that we're dealing with people. They've created systems of business around.
Well, because the structure that you're put in.
Yeah, it's a business.
It's not like Venezuela. It's or becoming some parts of it, of course, but it's that personal touch maybe is lost in some places.
It's lost in a lot of places. Nursing has lost a lot of its luster. I think after the pandemic, when nurses didn't feel appreciated and didn't feel like they mattered, because if you had a COVID patient, that was a big deal. But if you were a nurse with COVID, put on a mask and show up, sis.
Right.
That's what, it wasn't so I think.
No time off for you.
Correct.
Yeah.
The hospital is not closing. And I think during that time, a lot of nurses psychologically checked out, but they're still practicing.
They're still there doing it.
So because I'm now in nursing leadership, I am dealing with the remnants of what it looks like to try to reel people back into the care of humans and not numbers.
Yeah, what about that? So when I think about nurses, obviously there's a lot of such great nurses out there, and we appreciate them, of course, and we always say even like part of like the first responders, especially in the ERs and stuff like that. So, but are you finding yourself as a leadership role now doing a lot of like, not like therapy, but like a lot of talking?
Oh my gosh, yes.
To these nurses that are alive still in there?
Yeah. You become a social worker, a life coach, like you're everything when you're in nursing leadership, because you have to keep bodies at the bedside. But those bodies also have families and situations and other situations, politically influenced situations in some areas where there's a lot of nurses that are of different descents. So it's you become an everything, which means you have to be whole in yourself or you will burn out very quickly.
What's is there like, and I'm sure there's no one easy solution for all this, obviously, but like, what is one thing you'd love to see just changed about the system right now?
Oh, if I had a magic wand, let me think.
Yeah, if you had a magic wand, you were to wave it, and all of a sudden, at least part of this maybe is just a little bit easier for people.
I would remove the regulatory barriers to providing adequate care.
Okay. What does that mean?
Because we have tied care to reimbursement, and profitability is part of the piece of the ecosystem. We have care that is driven by reimbursement rather than by holistically caring for the human. So like we overcare in some situations because those are big dollar reimbursements, and the parts of them that should be touched more, healed more. Like we don't support psychological services or mental health services.
There's no money in it.
There's no money and there's no reimbursement in that.
Yeah.
So you'd rather see that person keep coming through the door with their big diagnoses and not treat the underlying symptom of why they're crashing or why they're having an acute crisis.
Exactly.
I wish we would flip the system on its head and push more holistic foods, whole foods, and put a little more emphasis on nutrition and natural medicine. You know, I'm a fan. But I think it's going to take education on every angle to really tackle this, because we not only have to educate the providers, we have to educate the whole system that interacts with the providers. We have to educate the patients, and then we have to educate the educators that are educating the providers. So like there's an academia part of it that no one's even talking to or tackling.
The professors who are teaching these lessons.
Correct, because that's who's actually giving the information and the perspective initially to the provider. So if that comes from a biased place, that trickles all the way down the ecosystem.
All their students are kind of getting infected a little bit at a time by that. Yeah, and I think, one of the things I always tell, especially with my children, and they have questions about certain situations, I'm like, sometimes you just have to follow the money. Like that's the incentive for people, is the money a lot of cases. And so if you just follow the money, you find exactly why it's that way, right? So, and I feel like that's similar in this case. It's because the reimbursements are coming in, and so the hospitals are making money, and the doctors and all the other stuff, everybody gets kind of the reimbursement side of it. And then you want that person just sick enough to come back for that big reimbursement again.
Or if you have somebody who is it's very expensive to take care of. I'll say a nephrology patient, somebody on dialysis.
Oh, right.
They're expensive to take care of. They're usually very non-compliant, because they have fluid restrictions, diet restrictions, and the government decided, listen, these are all the dollars you're going to get a year for this kind of diagnosis. Those are the barriers that then create the programming internally to try to reduce those admissions, because they're going to run out of money if they keep coming back, because you're going to get one check no matter how many times they show up. Once you've exhausted that check.
So at some point it just becomes not profitable.
Correct.
It's like you start going to the red,
and that's when they start educating and creating programs to avoid those situations.
Got you.
So there's a balance. There's a lot to unpack there, but there's a balance that we can achieve in healthcare if we focus on reducing reentry, improving wellness at home, and really changing the system to prioritize mental health.
Yeah, and education is a core component of it at all levels.
I know.
And I think, taking it from a cannabis brand perspective, education is so expensive, though, to get people out there educating consumers or even just, providers, healthcare providers. So pivoting off of that a little bit, you also, I feel like part of what you're doing right now in advocacy is also for social equity participants in cannabis and things like that. And there's a lot to unpack there, because now you're going to the state house. You're showing up, showing your face and being like, hey, I'm here and I've got a voice and I'm going to say something. And then hopefully you're able to convince some of these senators and representatives to actually, make a change, or at least change their thinking a little bit to make some positive changes. Let's go to that real quick, and then we're going to switch to cannabis again, like deep into cannabis. But like for now, I'm really curious about like, what are the things you're advocating most for right now for the cannabis regulations? Like what's the biggest one you're thinking about?
I think medical access. We're losing medical access to the plant, and it's happening mostly in cities of areas of disproportionate impact.
Yes.
When people are closing down their medical dispensaries, it's because they're not profitable. And money talks, right?
Yeah.
So what's happening is that people are now having to go further to find their medicine. But if you take away the vertical access to the medical program, you can now have all these social equity licenses and small businesses in these communities be able to serve both recreational and medical patients. Yeah. And that immediately doubles your access in areas of disproportionate impact.
Yeah.
And it allows then the community to create programming to educate people. It incentivizes those dispensaries and business owners to educate their medical population, because it impacts their bottom line.
Yeah, if they can participate in some awareness campaigns and stuff like that, people are in the dispensaries are going to be happy too, because they'll be like, hey, I've got these people coming into my store now that can get medical cannabis. Yeah, and I think, one of the solutions I think has been proposed is having adult use stores also be open to medical.
Yep.
And deverticalization, right? So now you can just have a one license type. If you want to just be at a store and have medical, you can get it, or a producer like we would be and get the medical, then you could get it as well. So we could produce medical grade products for patients. All for it, 100%. I think it's so old I've been talking to people about this for years now, it seems. And it's just like, why can't we get this done still? Do you have hope that it's going to happen this year? Because for the audience who doesn't know, a vertical integration, right now, medical is vertically integrated, which means that if you want to have a medical license, you have to have cultivation, which is millions of dollars to build.
Correct.
Product manufacturing, which is probably another million to build. And you have to have a dispensary, which means there's another million or two to build on top of that. So you need $5-6 million just to do a medical. And then on top of that, you have to pay $50,000 a year per license.
Correct.
Just every year to the state to be able to be in the medical program, whereas it's $10,000 per license or $5,000 depending if you're in the social equity program and stuff like that, and other, like, I'm minority business enterprise, and so I also qualify for $5,000 a year. Awesome. So it's cost prohibitive to do medical right now, and the patients are dwindling because they can't find the stores near them. Correct. Like, why would you renew it if there's not a medical store within a T-stop or whatever? You know what I mean?
Correct.
So that's a huge one for me also. Definitely, I see kind of like all the good reasons for doing it. I've also heard pushback on it though, right?
Really?
I've LinkedIn, I don't know if they're trolling or whatever, and people are against some of these things. But anyways, do you see this being like a slam dunk when they go to kind of put this into law? Do you think it's going to happen?
I hope it does. I think what's happened with a lot of the bills is that they've gotten tied up in other bills.
They're all kind of commingled now.
Correct. So now, like, one piece of this one is with that one. So if you want this one, you're going to accidentally get that one. So then you're opposing bills that have some benefit because you don't like that one line at the top.
Right.
And I'm calling it the political dance that we do when you have lobbyists at the state house and you have big money behind it and they're pushing, and then you have the grassroots efforts that are pushing. And it all requires education. If our senators and our leaders heard from educated people and took their testimony heavily and looked at the data. We have the data, just look at it.
Right.
If we looked at the data, we would know what the next step should be. And my whole thing in this industry, because I'm a clinician, has been just look at the data. We collect so much data.
Right.
We have an open data section that people can manipulate and create their own spreadsheets out of, and they're tracking everything. So why aren't we spending resources on analytics to really understand the health of the industry, the moves that have been made so far, and how they've impacted them. The other piece is transparency and documentation. We know that there's people above license limits, and they're lobbying very heavily against, for a license cap
Increase,
increase, because they're in hot water. So documents are coming out and all that other stuff. But we know this, and it's like, it's cannabis industry rumors, right? But this is the kind of stuff that we're dealing with. And instead of looking at the data and being transparent about the data, like, let's clean up the CCC's ownership inventory. Look back. Who owns what? You don't know who owns what.
Right.
Like, you don't even know who owns what.
Right.
So if you don't know who owns what, how do you know what the change that you're going to make and how these changes will impact the data set that
Instead
you
of
don't
just
even have?
blindly raising it without looking at the data.
Just look at the data.
You got to look at the data.
Yeah.
And so the way that works for the audience is that if you're under 10% ownership in a store, you don't have to report it to the CCC.
Correct.
However, there are rumors that through shell companies or whatever, that there are people out there that own actually more than 3 licenses, which is the current cap right now.
Correct.
So you're saying basically look at the data. You have all the license applications, right? So like you should be able to actually uncover like if there are already these issues.
Build a bot and upload the data. It'll tell you what it is.
Right, exactly.
Like, build your own master data set and analyze it and talk to the data and say, what do you see here? Like, where are their alliances? Like, we have all this technology. We're not even using it. We have all this data. We're not analyzing it, but we want to make changes. What you don't measure, like, is useless.
Right. Well, I feel like to a certain extent, and this is it's such a convoluted mess at this point because the CCC is just going to do what the legislature tells them to do.
Correct.
And so the CCC might advocate internally for certain things or for certain changes, but it's the legislature that might make that rule that says, hey, we're going from 3 to 6 over the next 3 years or whatever. So 6 you'd be able to have if you're a store that has 3, you're currently capped, but then you can go to 4, 5, and 6 in progressive years after that. I think is the way the current implementation has been written. But the CCC, they might have the data, but they also don't, they can give the data to the legislature and present maybe things to the legislature, but I don't know how much activity the CCC actually has at the legislature level, because what I think about it is like, are they showing up to these meetings and giving kind of like the data at least?
I don't know. I don't know if they've been required to.
Right. They're not. I don't think they are.
So
unless the senator says, hey, could you please participate? I don't think they really
I haven't seen them in
do
yes. But
So,
I really think what we need to do is just organize ourselves.
well, that's what I'm saying. It's a huge mess. It's like,
Correct.
and because everybody points to each other, even the whole HCA thing, which is the impact fee, the 3% up to, I'm going to clarify that, up to 3%. It's not a tax, it's a fee. Up to 3%, and towns were just like, it's 3%,
Correct.
and you have to pay us regardless, and we don't have to show you anything.
Correct.
We're just you're gonna owe the money because you have an impact. We just don't want to tell you what the impact is.
Correct.
And so when you think about from that perspective, the CCC is just like, well, we say it's like this, and then a judge will say, well, the CCC doesn't have any control over it. And then there's a huge mess at even STEM Haverhill and all those other things that are coming up. It's just like, well, who actually, gets to change these rules sometimes? And the CCC, if they're sometimes just not clear if they can do it.
Correct.
So they're just like, what do we do?
I think
it's dysfunctional at this point.
It is. And I think what we should have done with that situation in particular is design a framework that would hold both sides accountable. There was no balance in that. There was no balance of power. It left operators very vulnerable.
It was very gray. It was just like, hey, impact 3%.
Correct.
And the towns were like, yay, we get more 3%
Correct.
of their
People
revenue.
were buying fire trucks and all that. Like, shout out to Fall River. Like, there was a lot of nonsense happening.
Right.
But had we built a framework and say, impact fee, and impact is defined as, like, we had no definitions, we had no blueprint, we had no framework.
Yeah, it was up
we
to
just had to kind of check.
determine.
Yeah. And the town is usually just a bunch of townspeople trying to figure out how to pay their bills.
Right, exactly.
I go to my town meetings. I know we're a bunch of townspeople trying to figure out how to pay our bills.
You gotta, if you show up to the town meetings, you'll see where all the money is going.
Correct.
100%. So you'll be like, hey, we want to build a new school, a new middle school for our kids. And everybody's like, the kids and all this other stuff. But like, it's also going to cost $40 million. So where are we going to get that money from? Mm-hmm. All your bills are going to go up. Or there's a couple cannabis companies over here paying us 3%. So let's use that money. You know what I mean?
Correct.
But again, how much of this has actually come to fruition? I don't have actual records of people doing stuff like this, so I want to be very clear with that one. But has those implications where like you can kind of just use the money for whatever. And I won't go into the horror stories of our HCA, but I do want to get to, actually, before we go there, because I do want to talk about your HCA, I want to talk about, so deverticalization, capping, keeping the cap at 3. Is there is there intermediate solution you're proposing besides you're just keeping it at 3 and you're moving on?
I propose we look at the data.
Oh, okay.
So don't make changes until
just don't do anything right now until you know the data.
Until you know what you have at hand.
Yeah. Is there anything else regulatory-wise that you're kind of like?
Oh my gosh, the purchase limits.
Oh yeah.
Yeah.
Okay. So I think it's doubling. Is that what it is?
Correct.
Yeah.
I'm going to tell you a story from the depths of the community. If I can call my friend and buy my entire month's supply, I will. And it'll be delivered, and it'll probably be as healthy as the one I can get at the store. But if I have to bake in an hour showing my ID, finding parking, going in, and if I'm a true medical patient, an ounce is not going to cut it very long. So it's like buying vegetables. Every 3 days you're at the dispensary. Like they need to increase the purchase limits to be realistic. And also because it impacts other things, like for me, I'm a big beverage person. So if I want to throw a party, I have to shop a month in advance to get all the good feels I need for my bar, right? For my salt part. So it's like, how can you support social consumption licenses without supporting an expansion of the purchase limits because you're asking people to privately purchase for consumption?
Yeah, and I think that's the trick though, because it's like if adult use would allow medical, then the medical patients would also get it, because that's also part of the fact that you can't even find a medical store to go and buy these higher allotments. I guess the allotment for medical it's different, right? So I don't remember the exact numbers. Do you remember the exact numbers for medical?
No, I don't remember the exact numbers for medical, but I know that they're definitely different.
It's a different calculation.
It's like in a concentration. I don't know if it comes part of the prescription process, that they have like these predetermined prescriptions that you can have. But they definitely are allowed a lot more.
Yeah, so they're allowed more, but I think like when you start bumping up or doubling it, again, it kind of gets closer to that level. Do you think medical would if we could just deverticalize medical, that potentially would solve that potential issue? Because then you could have a medical card, but then you can't share your medicine. That's the other thing. Yeah. And so if you are throwing a party, you technically can't throw it with medical products. So there's a lot more to it.
Yeah.
Anyways, is there any reason to even have a cap on the allotment?
No.
From a nurse's perspective.
From a nurse's perspective, no.
Did you see a lot of cannabis patients? Not cannabis patients. Cannabis incidences as a nurse, or no?
No, but I'll tell you what I did see. The minute somebody discloses cannabis use, you get a psych consult.
So somebody has to come in?
Because you're a substance abuse addiction diagnosis. So you automatically get a visit from a psychologist or psychiatrist because a consult is placed as part of your admission screen. So one of the things that I've been working on through education and on the back end is even changing the language in the admission questionnaire, but then you have to educate everybody about this language.
Education comes along with it again.
And then you have to build a framework in the electric medical record, and then you have to then deploy the new standard and have a national... It's like a thing.
That's
just
big,
to
sounds really hard.
Identify a cannabis patient as just like a different medication. You're literally, the minute you say it, you're checked box with you drink, you do crack cocaine, like that.
You're in that same group.
And you're in that category.
Yeah.
So whether you're having pain or not, you're a med seeker.
Med seeker. Like now some of you ask for opiates and stuff like that.
Correct.
Right.
There's a stigma to patients who have substance abuse disorders because they don't have impulse control. So they do med seek and they do behave erratically in the hospital, but most cannabis patients don't.
Right.
They're probably there for an exacerbation of something they were treating with cannabis that they couldn't handle. Like Crohn's patients are infamous for this.
They'll come in and they'll say, I'm a cannabis user.
This what happened. Yeah, I started using cannabis for CBD for my Crohn's. And now they're like, why is the psychologist here? Like, I'm just, I'm having bowel issues.
Right.
What the hell is this about?
Right.
And then you have to, and as a leader, how it impacts me is that I have to do service recovery. Because their survey matters, and it's public data. And we're measured against survey, nurse leaders. So like the hospital surveys that you get after you get discharged. So part of my job as a nurse leader is customer service, big time. but y'all done made them mad. So like,
They're not giving you a good review.
correct.
It's like a restaurant on Yelp. It's just like,
yeah.
this person was rude to me,
So
one
like,
star.
I come in and they're steaming hot,
Right.
and so now I'm like the patient whisperer, trying to like talk them off the edge, help them understand. But it really takes me understanding that it's their medicine. So I'm so much more effective at that service recovery because I go, I know it's your medicine, and no one has said that to them in the hospital.
They haven't heard it yet.
No, they have never been validated that this is their medicine,
Right.
that they use it for good for their body. They've been labeled as somebody who's harming their body with this plant.
Wow.
Yeah.
So, anybody who's listening, this is a good clip, by the way. Don't disclose your cannabis use unless you want to go talk to a psychologist and be on some kind of list. You heard it here.
Yeah, you heard it here.
Wow. So I'll have to remember that when I go to my next thing. All right, when I go to my next doctor's appointment, be like, nope, not me. If you're into cannabis, entrepreneurship, or just like hearing from people who actually build things, check out High Functioning. It's real talk with founders, operators, and big thinkers. No fluff, just game. New episodes drop every Friday, and you can subscribe and listen at highfunctioning.show. All right, let's get back to the show. So anyways, moving on back into the business side of it again, the HCA side, you had a little bit of HCA things
Oh my
going on because you're
gosh.
trying to open a store right now, right?
Correct.
Yeah.
Well, I mean, there's news. Leslie's off camera, but Leslie has now stepped in as CEO of Zeb.
Hey, congrats,
And yes,
Leslie.
and I've moved on to, because you see this medical piece is a big chunk of pieces that we have to coordinate, and I'm perfectly suited for that part, the clinical education, structure, framework part of it. So I'm going to focus a lot of my energy on that side of the
Hey,
business.
that's
So I'm
fantastic.
super excited about that.
That's a huge education kind of component.
Yeah, like, because we're not building that piece.
Right.
And I think that that's the piece that's missing. We're never going to truly be successful if we're all chasing consumers instead of converting normal users into holistic wellness users. Like, everybody's chasing the same 35% of adults that use, right?
Right.
Like, imagine if you educated another 10. Like everybody wins.
Everybody.
Wins. So if you really invest in the frameworks around education and disseminating the education, and talk to the people who have a stigma, because I don't say this a lot, but I had a stigma. I was born in South America, daughter of immigrant parents. In the 90s, I was a DARE baby. I won a DARE contest for a poster. I have a picture with the police commissioner when I was like 10 years
With the
old.
DARE poster?
With my DARE poster that I won, saving, taking the world away from drugs and stuff. Hilarious. I hated weed.
Yeah.
My ex-husband will tell you, that was like part of in our agreement that he would not smoke weed ever again.
Whoa.
Like, I hated weed. So when I was going through postpartum and it was offered as an option, I had failed 6 months of like psych med trials. Nothing was working.
Whoa.
And my therapist was like, listen, you come in here in the same clothes twice a week and just cry for an hour. Have you ever considered cannabis oil? Like, he straight up was like, and I was like, me? My mother's a pastor. What are you talking about?
Right.
So like, I never considered it. So I had to like overcome my own stigma. And then in that search, as a 32-year-old adult woman who was managing a nursing unit, a dialysis center at the time, I had to go find my weed from like Craigslist, which is crazy.
That's
Because now that I think about it, like, why was I buying weed on Craigslist? Like, don't cops go on Craigslist?
Yeah,
but that's how I
yeah.
found. But he had like a different, like, you had to like, he had an ad and you had to ask and code. And this
How
guy,
did you learn all that? Just
because
online?
my coworker.
Oh, they were the ones that kind of showed you how to
Yeah,
go
like,
about
because
it.
I'm like, where do I get weed?
What year is this?
This is, oh my gosh, 2000. RJ was born in 2013.
Wow.
Yeah.
So no, it hasn't passed yet in Massachusetts, obviously.
No.
Yeah.
And I was in Georgia and I had a gun license and a gun permit.
Which
So-
medical gun, that's a whole nother
Correct.
thing. Yeah.
I'm glad it's out of the way now, and
Yeah.
we've made some changes to that legislation. But then I had to go to the streets to find medicine. And I was like, it's going to be my luck that me, the adult nurse manager, is going to end up on the news off some laced stuff.
Right.
I don't know how to smoke. I've never smoked. So it's like, I don't know how to consume it. I don't know what a dose is. So I would have this, I call him a teeny bopper now, but he was like 19 or 20. And he would come in with a one roll joint and he would charge me $20 and I would smoke that one joint every week. So like, because I didn't know how to roll.
Right.
So I would like, and then because my mother had come down to help, because my postpartum was really bad, I would have to hide from my mother what was actually helping. So my mother's upstairs praising God, talking about God is recovering her, and I'm in the garage sneaking a smoke, and like that. And my insomnia went away, and now I'm functioning again. And I'm like, the story. My mom's always like, I prayed it out of her, and I'm like, yeah, so did weed. But it's like that whole concept is what kind of led me even into this industry and looking at what happens when an adult who's never smoked has a stigma, has children, has a job and a career. What happens when they want to try? Right. How do we educate those people?
Right.
We have a whole bunch of people who are afraid to smoke because of job. We don't have protections.
We don't have protections on jobs.
So, and actually, I just wrote an article about that, but that's for later. But like, how do we build structures around gaining consumer trust by making sure that each consumer has an opportunity to learn how to interact with the plant? Because the other part is your endocannabinoid system is very individual.
It is. It's
I'm a
unique to you.
lightweight. Yeah. Like edibles, like if I have a 10 milligram edible, I'm on the couch laid out.
Right.
Some people need 50.
Right.
Like it's very individual. You have to learn your limit. I remember the first time I got too high. I was high for like 18 hours.
Wow.
And I swore
Was
I'd
that
never.
in Georgia?
No, that was here.
Okay.
It was for beverage. Somebody was mixologing a little too heavy.
Got you.
They were supposed to use a syringe. They used a little cup. Yeah. So I
Mixed up the
accidentally,
dose.
yes,
Yeah.
I accidentally got too high, and I was like, if anyone ever has that experience, I can see them never doing that again.
Yeah, they'd be like, I'll never touch it again. I agree.
Correct.
And I've heard stories like that before. I had a gummy once, and
And,
my
yeah.
friend made it for me.
Correct. I ate a brownie.
Brownie.
Yeah.
Like we didn't know
all
what
of
was
that.
in it. And so I had one brownie. I'd never have another cannabis again. And you're just like, but you're missing it.
You're missing the learning of how it interacts with you. Like I used to smoke because I was around smokers that were social smokers all the time. I'm more of a drink person. That's what I prefer. I prefer beverages. I prefer tinctures. I do a lot of the CBD tinctures at night to just kind of settle down. But like no one is telling you that you have options.
Right.
And people are like, I don't want to learn how to smoke. I don't want to in my lungs. Some people have respiratory issues that they can't deal with, actually do need the CBD because it's the best anti-inflammatory ever. Or they need that and they're afraid to even consume or find the middle ground for their COPD because they think the only way to consume is through smoking.
Yeah. And it's so limited because they think of those old Cheech and Chong movies or whatever, and there's like this big giant blunt, and you're like, that's not me. I don't identify with that. You know what I mean? And I think I came from a similar place where I had a medical issue myself, and I had to get over it, and I tried so many different solutions, and nothing was working, and I'm like, what am I going to do? And then I was like, let me just try, some CBD, and that started to help, and I added a little bit of THC, and then that was like the combo, and I was like, this is it. This is where I need to be right now. And now I've been a consumer ever since and started a company over it. You know what I mean? So you went through this whole thing. You were the queen of stigma. You were like, this is not in my house and all this other stuff.
Correct.
You turned a corner. Obviously, it's going to take a lot of education to turn other people into that because, and that's what everybody says is like, there are people who are still walking into stores, but the stigma is so great. And it's so hard to overcome sometimes. And even though we always say like the stigma is definitely like falling a lot, getting people to come into the stores and actually, do it their first time is also very intimidating.
Correct.
So when you're thinking about maybe your stores, your store, like, are you already planning like is there an onboarding? Is there community awareness?
Oh,
like,
listen.
what are you doing? What are you up to?
So we do the work before, obviously the license we had the provisional licenses in hand. Leslie's leading the charge on that. So we had built a platform called Canniversations. I don't know if you've heard of it. We've had 2 brunches after NECAN. It's the Sunday morning after NECAN. And it's focused on bringing in the community who's heard all the hoopla about NECAN and all that, like leveraging the advertising that happens around the city. And people who are not necessarily interested in being in the industry, but want to be part of the community and the effect. We have it at a restaurant called Hugh, right on Huntington and Exeter. And we talk about anything. Conversations is what I actually was talking to the owner of Hue. Shout out to Rob. He's a marketing genius. And we were talking about the kind of event we wanted to have. And I was like, when I became a nurse, everybody would call me with like, hey, what's this? I have this itch here. Or let me send you a picture of this. So like when people that learn that I'm now a consumer, they're like, if Dru's doing it, then I mean,
I think that's how you get those walls to fall, right?
Correct.
You got to find somebody who's like, again, high functioning podcast,
Yeah.
a high functioning person who's able to still be full of life and able to, accomplish great things, can also be a consumer, and that's not a bad thing.
Correct. And for them to, and I was doing it in the closet for so long.
Right.
They noticed the positive change. They noticed the introspection, the slowing down, the mindfulness, the anxiety going away, and my eye twitches slowed down. Stress will still get me sometimes.
Yeah.
But like they saw the change, and then when they're like, oh, that's what it was.
Right.
Because
right.
now I'm like, okay, cat's
Now
out the
you're up with
bag.
it, yeah.
Like I smoke. It was a thing. And I struggled with even that identity of identifying, like, do I even belong in this industry? And I think in terms of like the framework, Conversations became a place where we could have conversations about anything.
Mm-hmm.
Like the article I wrote is, I have a Conversations column in Cash Color Cannabis magazine. And it comes out 4 times a year. So we just did an article on work protection.
Yep.
And testing and what comes out in testing.
Yeah.
I spent 3 months doing research, tapped into J.J. Johnson from the hemp side of things, and really put together a thoughtful piece about what it looks like to try to learn to be a consumer as an adult that is subject to drug testing in an environment where it may be legal in your state but not federally, and kind of the nuances of all that. And those are the conversations and the audience that we're building that is anticipating the store being a place where we can have a setup like this. We actually envisioned having a podcast studio in the lobby.
Yeah, great.
Like, because
that's what Major Bloom does.
Yeah,
they do that.
conversations.
Yeah.
Like, because we want to continue to have those conversations with the community. And that's where I'll be focusing a lot of my energy, building the frameworks and the programs to educate the community in a language that they understand.
Yeah, that's fantastic. So it resonates really great with me because education is obviously a component, but it is really difficult and expensive to do sometimes. But if you're able to stand up and say, I'm a consumer, and look at me, I'm high functioning, I've accomplished a lot of stuff in my life, and I can still consume, and it actually helped me and benefited me and makes me potentially a better parent. I can say that for myself.
It makes me, oh my God. My kid will look at me if I'm cranky. She's like, have you had your medicine?
Right, exactly.
Like, she knows.
We call it the medicine out of our house, too.
Yeah, she said, have you had your medicine, Mom?
Yeah.
She's like, I think you need to have some medicine. Go for a walk. Like, my kids send me on a medicine walk.
Yeah, exactly.
When I'm acting crazy at home. So, yeah, like, we want to educate in a way that benefits everyone. And I think the things that we're not thinking about as an industry or being creative about is using spaces that are non-licensed adjunct to spaces that are, to really create the opportunity for the whole community to come in and experience the calmness and the peace and the information.
Yep.
The information that is, and do it in an environment. And I think part of that strategy was because we're parents and we're like, where are we going to put our kids if the entire building's licensed? So we had to find a creative way to find unlicensed space, and then thought this is such a good place to build a conversation and build the community where you can go digital and you can have an audience in the room asking questions.
I like that.
And then you're truly brand partners with the products that you carry, because they're part of your education. They're part of like whatever you're trying to do in the community. And it forces people to truly build a menu. So brands that are not focused on community engagement, education, onboarding people to their products, differentiating themselves in the right way, in the right categories, are going to start to disappear, because people are going to want the education. They're going to raise their expectation of what, like, if a brand does not teach me how to use their product, help me maneuver through the questions, help me engage in a way that's thoughtful, if they're not out here doing the work in the community, I'm not gonna connect with them.
Correct. Because I like the idea of community engagement has come up many times on this podcast, and I find that the best operators have learned that at this point. And speaking from the startup side of this and starting a company and all this other stuff, when I think about like what you had to go through to get this particular spot, for instance, like, is it kind of a blessing in a sense, because you got to see all these other things happen around you and be like, oh, I'm glad I didn't, because sometimes I say that about myself, because we had like a little investor around ourselves, but due to the constraints of not raising all the money we could,
Correct.
we only had a little bit of money, we had to figure out how to survive with that little bit of money.
You gotta be scrappy.
You got to be scrappy.
Yeah.
And so like sometimes I find like, because sometimes you get these people coming in like, oh, you know, especially in 2019, 2020, here's $5 million, go have fun. And it's just like,
Now
where they're gone.
They
don't
are
exist
not
anymore.
around.
Right.
They're not even at Benzinga, okay?
Exactly.
Like,
They
the
spend it all money on the parties at
they're like,
Benzinga.
they're not there to give you money. They're there to entertain you. Our story is so unique because we were deeply rooted in serving the community. That was like a high priority. And deeply rooted in being a center of education, holistic health, destigmatizing the plant. I introduced the plant to my mother. Leslie introduced the plant to her grandmother. In the way that we live and interact with the plant, we're introducing it to our elders to support them in their life as they're transitioning into older age and have different aches and pains. We make a topical called Bed that my mom loves, and like she swears by it. She told her orthopedic doctor that's why she wasn't having surgery, and she puts her daughter's little weed thing on her shoulder. And so it's like we were so committed to that we were almost stubborn about the locations we wanted to be in the community. So although we could have chosen an easier path and gotten an HCA through, paying somebody off, we spent the time dealing in Boston in the communities that we were raised in. It is a blessing because we started in Mattapan, where I was raised, at one location, obtained an HCA, and had the best lesson about landlord relationships we've ever had.
Oh, the
and
landlord.
LOIs. We learned a lot about LOIs.
LOIs, yes.
And how
Letter of
non-binding
intents.
they are
Right.
and how useless they can be. We learned a lot about tenant protections with location number 2 and how there are none for small businesses. Massachusetts is known for having tenant protections for residencies, but
not
businesses, no. Listen, $80,000 later and no upgrades or work done to the building that we've been holding. We then ended up moving out of Mattapan into the community where Leslie was raised, which is in Dorchester,
Right.
which we ended up in now. But then we were faced against a temple and a field where all the
neighbor?
children's sports. So to the right is the Buddhist temple, and across the street is where all the children's sports happen. And I've always felt like that was a gift because it gave us the unique opportunity to educate that community of what a cannabis consumer looks like. We brought our children to the community
Right.
meetings. We're mothers. We're also concerned about underage consumption.
Right.
We are also trying to prevent children from accessing the plant that is not for them yet. We are with you on that.
Right.
We will be partners and make sure that our policies are essentially in place to prevent that, because our kids are going to be playing in that park. We don't want people smoking over there.
Right,
So
right.
it gave us the unique opportunity to then destigmatize the plant for immigrant communities. And because what they've seen is weed on TV. Like, they thought Snoop and Redman were going to pull up and they're going to be smoking out front. And there's going to be smoke coming out when you open the doors. And it gave us that opportunity and actually the visibility to the need for education in different languages.
Are they now welcoming a little bit?
No, they're
or-
not. Absolutely not.
No.
But I think in those situations when we're dealing with older, very stigmatized communities, you have to start and meet them where they are. So one of the things that was the most clever thing to do was adding lemongrass to our topical and sharing it, because lemongrass is a plant that they're very familiar with
Right.
and they trust and believe in its medicine.
Smart.
Yeah, so you meet them where they are and you educate them with something that is familiar to them, and you let them know that this is who you actually are at the core. I always say the hardest person to get over was my mom. I built an 8-foot tent in my living room. I tell this story all the time. I bought a tent. I bought lights. I had bugs all over my apartment. It was crazy. I found out I was allergic to the leaves. Defoliating is a pain in the ass.
Wow.
I started growing basil and cilantro with my weed because I was like, we're going to do something else with this soil. So it was an experience, but I had to show my mom that it was a plant.
Right.
Because my mom thought I was selling crack.
Right, exactly.
Yeah, she's like, and again, my mom's a pastor. So then teaching her and showing her, and when I would defoliate, I'd wash the leaves and make tea.
Yep, you can make tea out of it.
And
That's
then
right.
I would be like, here, try this before you go to bed. And it's that's not threatening to her. But if I pulled out a bud and started talking about, look at the trichomes, and my mom would be like, what are you doing?
And you're like, let's roll up a joint.
Yeah, that's correct. Like, my mom's not doing that.
Yeah, here's a bong I have.
Yeah.
Let's go. Yeah.
But if you show her that the plant in its natural state, as I was still growing it, and I'm not a grower at all, I learned a lot about growing, and one of the best lessons that I learned was I'm not one.
Right.
So, but really introducing the plant to people in a way that they can feel it and understand it. Mm-hmm. We spend so much time speaking different languages, and we think that marketing language is what's going to work because that's what marketing says.
Right.
When you really need to be community centered, when you're talking about something as sacred as a plant that they're not going to ingest into their body, and it's going to give them an increased awareness. Mm-hmm. Like being high, it opens your awareness. Yeah. So like you have to educate them not only on the physical aspect, but the somatic feelings that are going to come. You may get a flush of ideas, or you may have some cries, because you're like, oh, I remember that time. And I've done that high, just got really high, started crying for no reason.
Right.
Nobody told me that was part of the somatic experience of cannabis.
Right.
And we also don't know exactly which terpenes or which combinations because we're not doing research.
It's so far behind. We don't, because that's why I think in many ways businesses are the first kind of guinea pigs in this sense, because we're just experimenting with a ton of stuff right now, and we do a ton of innovation on our end. I always tell people we have like 50 plus recipes in the background right now that we haven't launched, but like we're always trying to innovate and do something better and better and better to the benefit, right? Because one of our mantras is do no harm.
Correct.
Right? So we're always trying to do the benefit of everybody, and we don't have the science to back up a lot of this stuff. And I know there's people working on this stuff right now, and hopefully, we're able to do, some deeper science. And I know there's a company, for instance, like Floorworks, who's done a lot of studies on like CBN. Right. And they're always trying to push, because that's one of their big products that they sell. Right. And so a lot of the companies that, make nighttime gummies and our nighttime liquids, sleep formulas and stuff like that are using Floorworks' CBN, for instance, right? Because it actually they did do a study on it, and I think the efficacy of it was, I think you had to have 25 milligrams specifically with nothing else. It was just 25 milligrams of CBN at night, and it found it improved sleep. I don't know percentages exactly, but it improved sleep for a majority of the patients that they were putting under. That study is available online, so I don't have the exact numbers off the top of my head, but there are people doing this research to be able to start seeing kind of like the innovations that maybe Good Feels, Good Vibes is coming up with is eventually able to be proven out over time. But we know it works, and more importantly, we hear stories from everybody.
Everybody will tell you.
People are telling us all the time. We get emails daily practically being like, I love your product so much. It helped me with this. We actually had a previous podcast guest, Rob DeFazio, who runs CNA. He was saying he took it. He had a broken rib. He took it. He was like, basically, I didn't feel any pain anymore. I could, the rib was loose, but I didn't even feel it. I was great. You know what I mean? Got him through that.
We're going to have to get some for this foot.
Exactly.
Because, Lord, I haven't slowed down because I'm a clinician. I'm in the building all the time.
Right. Well, that's the thing. It's like, and I think that's one of the things that a lot of people who I bring onto the podcast, I think it's a similar theme.
Yeah.
The hard work that you're putting in, you're not about to slow down. You're still going, right? You whatever happened to your foot right there, you're still going. It's not going to slow you down.
Listen, no. We laugh a lot. Leslie and I ran the Boston Marathon this year. It was my first, her second.
Congrats.
It was my birthday gift to myself. Didn't realize that on my birthday, which was the following day, that I would be like a rock solid bush and couldn't move.
Exactly.
But we had a good time nonetheless. But then after that, we ran a half marathon 4 weeks later. Like, it was like, go, go, go. Like, I think the discipline that you learn through entrepreneurship and the drive and the grit and just the ability to multitask, the resources you pull in, because when you're being scrappy, like we're 4 years in, no revenue.
And you're being tested constantly.
You're being tested against the grain.
Yeah.
And there's no other place where you can go 4 years with no revenue and still have the fight and the grit and like the motivation that I've seen. Like Leslie works 40 hours a week. I work 40 hours a week. Well, and then there's another 40 hours that go into the other things that we're doing. And I'm always grateful that there's two of us because I can focus on the education.
Support system.
I can vent and I can cry. I can talk about the frameworks that are hard. I can talk about what I'm seeing in the clinical world and how this is going to impact it. But I also can inform the business decisions that she's going to need to make, because I'm like, this is what I'm seeing. This is what they need. This is how I'm working it from this perspective. This is how we're introducing it in these places. And, you know, I call myself I plant seeds. I'm destigmatizing one word at a time, one moment at a time. When hospice or palliative care comes in, I go, do you guys have a cannabis nurse on your team? You know, have you considered introducing the patient to it? And as a director of nursing, my voice matters. So being in a position to be able to advocate for the plant and within the healthcare system and build education frameworks around it and curate events, that's dope to me.
Yeah. I think we've talked a little bit about events, and I think that is, you know, that's a great piece to educate, and you know, people can have fun still, but it's about, you know, if we can figure out how to educate people at the same time, that's a win-win. I think there's, you know, a lot of the events that are happening right now are traditional. Hey, it's like, I see you at every single event, and I've seen you at 7 events in a row now. Like, I like you, but there's other people out there, especially like potential consumers who aren't going to cannabis events because they don't resonate. It doesn't connect with them. Be like, oh, well, that's not something for me.
Correct.
So finding other events or creating other events that resonate with the people who potentially could benefit from some of these things. And I think obviously taking from the nursing perspective means like you have just a different level of understanding with it too.
Yeah.
So that will help your consumers when they finally walk through your doors.
Like, it builds trust in my voice, because I'm never just looking, and because I had to overcome my own stigma. That's the part that I always emphasize. I had to overcome my own stigma to allow the plant to help me.
Yeah.
And I know what it did. And I always say that the path that I pave is really the lessons in the life that I had to live to become this version, to be able to help somebody else figure out, let go of all that fear and say, this can actually help me. I've seen it help people as they're ending their life.
Yeah.
And in palliative care and hospice, my former mother-in-law had breast cancer, and that was the first medical patient that I actually saw in real time. And as she was ending her life, she didn't want to eat. She didn't have appetite. She didn't have energy. And cannabis helped her maneuver. She was a special needs teacher, and she never retired. She wanted to keep teaching, and cannabis allowed her to do that. And I think if we have given people the options to truly live without the shame and the guilt that comes from being a consumer, then we're unlocking another piece of them that they can actually be authentic in their lives and in their moments. And watching her be able to teach as long as she was able to teach and go to the high school and interact with, and I mean, special needs teacher in the city means you have the most difficult students. There are mostly behavior and mental health needs. And watching her be able to nurture those boys and girls as she was dying and going to chemo after school, because she had support with the plant was like very transformative for me as well. Right. Like, it was like the first seed that was planted, and being able to see that's somebody who's like, this is helping her live. And I think we lose touch that we're consuming a living thing, and it's supposed to enhance our lived experience. And we lose touch with the healing part of being fully alive. And I think that that's so important, and we need to really focus in on educating people on how to live well, so that they can decide where this plant fits or if it doesn't.
Or if it doesn't, exactly. Correct. It's not for everybody.
Yeah.
We're not trying to push it on everybody, you know, because it's all about the dollars at the end of the day. We're saying from 2 people who have lived it, it has a lot of benefits. I wouldn't be in this industry, and I wouldn't have spent all this money starting this thing if I didn't believe in it.
Correct.
Right?
Yeah.
So what does the future kind of, I guess, hold here? So where are you going from here? Where does Zeb stand and all this?
So Leslie's
provisional.
Leslie's taken up to the finish line with the provisional. I am focusing a lot on the holistic and the wellness side. I think I have the only self-help book that mentions cannabis as a tool.
Is this the book right here?
Yes, that is the book right there.
Truth and Triumph.
I wrote that.
Let's walk through that.
Oh my gosh, I wrote that 7 years ago. I actually wrote it 10 years ago, but I published it 7 years ago on my grandmother's birthday. So my pen name is my grandmother's name, Mac Vernette, which is also the name of my consulting company. Oh. I know, kind of cool. And I like to build frameworks. So I built a framework that helped me transition. And I've had a lot of transitions, so I do a lot of journaling. So as I would reflect, I realized that I transitioned from Venezuela to the United States, and how did I manage that? And then I was like, I transitioned from, being in a small school to being in a huge high school. Like, how did I manage that? And then I went to college, and then I had a man, and then got married.
Right.
Like, so.
And you were expecting to be a lawyer, and then you were like, I'm a nurse.
So many transitions. And then I was getting divorced while I was pregnant with my second child.
Oh, wow.
So that was a transition that brought me to the bottom of the valley.
Right. And the postpartum issues.
Yeah. So then I had to crawl out of there, and I didn't want to tell the story of all the harm. I wanted to help people crawl out of the bottom. And I was like, okay, what were the similarities? So I'm an analytics kind of girl. I'm like, I have the data. What did I always do first? And I would say I would have to recognize the issue. Because you can, sometimes you're so in it that you don't even see it. You don't see it.
Yeah.
And then the second part is the hard part. I call it the long A. You have to acknowledge it. And acknowledge your truth, and acknowledge how much of it was you, how much of it was the issue, how much of it is programming, how much of it is systems.
Yeah.
But you have to acknowledge, you're the one that has the power over you. So part of acknowledging your truth is really coming to terms with your own power and understanding that you're the common denominator in all of your lived experiences.
You're it.
You're the
it's on
only,
you.
Yeah, it's just, that's it.
How you want to receive that is up to you.
Correct.
Right.
And then I realized that processing what was available to me came with some barriers. I didn't see cannabis as something that was available to me because I had a stigma. So processing what's available to you is not only looking at what you're used to looking at, but also thinking beyond what could be available. What is the best case scenario? What do I need to have in place for this best case scenario to play out? And then the I would be ignite your own fire, which is where you implement. And then you really just, because all that talk without action is nothing.
You got to get up and do it.
You have to get up and do it. You have to have an implementation plan. You have to set your goals. You have to measure. You have to track.
You have to measure and track. That's a very important part of it, actually. Yeah.
Correct.
You just do it, and then you don't know success.
Yeah.
It's so interesting because I think you're spot on, especially with that part, because you don't realize how far you've come sometimes unless you're tracking it.
Correct.
You look back and you're like, oh, I did all that?
And that's because when you're a high achieving person, you're always moving the goalpost.
Right.
So
100%. You're like, oh, that's my next goal. I got to get to that level.
Correct.
And then I'll be happy with myself.
Correct.
And then you move it, 10
know.
yards down. You're like, oh, no, I'll be happy when I get to that part.
Yeah.
Oh, I lived that.
Which brings us to the letter D, which was the simplest but the hardest, because the D is for decide. And you think when you've recognized it and acknowledged it that you've decided already, until you have to live that way. And decide means every day in every situation, I am deciding to be this new version of myself that has gone through this process and has identified and has transitioned. And the truth is in your everyday decision, and understanding that it's all the micro decisions that really lead up to where you end up.
Right.
So because you're the common denominator in all your lived experiences, deciding looks like every single day being intentional and active in how you move, the things you do, the things you have in place. When I wanted to run the marathon, someone told me, you say a lot, but until I see you running 10, 15 miles every weekend, I'm not really going to you can say you want to run the marathon, but you have to show up in January when it's 20 degrees and raining and your feet are on ice. Yeah. You have to show up for that 20-mile run that takes you 18,000 hours because every weekend in January it rained. It was crazy. Right. I was like, this is marathon training was like life training. But as you're alone for those many hours, I would literally be doing rapid in my head about everything. So now I'm going recognize, acknowledge, process, all right, plan, all right, got it. And then the hard part, and the part that cannabis helps me with, is deciding with my body. So when you make a decision, it's a mindset shift. You make a decision, you can act. But if your body is still tense and your nervous system is still escalated and you're still feeling anxiety, you haven't decided with your body, which means that your reality is never going to reflect the decision you think you made. You could be performing your way there. Because, I called it productivity, but I was really just performing and hiding behind the overthinking by just being overly productive. I have 8 balls in the air and look at them, I'm juggling them all. Instead of saying, ooh, it doesn't feel safe to have 8 balls in it.
Maybe I only need 3.
Yeah. And how do I feel with 3?
Right.
And am I looking for acceptance? Is that why I want 8 instead of 3? Did my community tell me that I needed
Outward thing, right?
It's
People
the
outside of
validation.
you.
It's the external validation that you're seeking that keeps you from feeling it in your body. So deciding is really moving into the somatic space where you start to become what you think you are. Because people say, you are what you say you are, or you say what you think you are. You really have to become that version of yourself. And for me, cannabis helps me connect internally, helps me relax. I do it with meditation. I'm big on meditation and breath work, but it really helps. It's like the tool that helps me get there quicker. Because I used to wake up and my mind was on 12.
Right. All the way straight
listen,
to it.
every tab is open. You're just like, mine's on 12.
Right.
And you don't realize how unhealthy that is until you wake up and your mind's at 0. And I still sometimes wake up with my mind on 12.
Right.
And I grab my little syringe and I take my medicine and I let my mind get to 0. And then I can sit there and be innovative. I can be creative.
Right.
I can think clearly. I can think from a place of presence. I can be a better business person. I can be a better leader.
Right.
I'm not looking at things from fear. I'm not looking at them from anxiety. I'm looking at them from like a place of wholeness. And I think that that's what's important, understanding that self-help also means processing the tools that are available requires that you make yourself available to the tools as
And
well.
open to them as well.
Yeah.
And that's the stigma part. Like, you got to be open to it.
Yeah.
And it seems like you have such lived experiences that in all those transitions, I think it probably took you a long time to figure out how to transition smoothly.
Oh my gosh.
Because there's so many rough transitions, especially when you're 9 years old. Nobody gives you the tools and how to transition in this moment, right? You're just kind of thrown into it. And it's similar to my mother's story. When she came over when she was 15, her father, basically, quick story, if I can go into it really quickly.
It's your podcast, dude.
No, I know, but like I don't want to take it too much. It's not really about me, right? I'm trying to highlight other people. But back when my mother was very young, my grandfather, who I never met, he had died when he was younger, I think from a cancer-related thing, in his 40s, and he was a merchant marine in Tela, Honduras, so Tela. And on the beaches, right? So there's ports there, and Banana Fruit Company, United Fruit, all those companies, right? So he had a banana plantation, 1,500 acres or something crazy. It was huge, right? Horses and all that. So my mother lived on a farm.
That's awesome.
Next to the beach, though. It was like the beach was right there. It was beautiful, right? So I've been there a few times. It's beautiful. And my grandfather was playing football with some guys in Charlestown because he was in port at the moment. Yeah. They were throwing the football around, and somehow, I don't know if it's my grandfather, I never met him, somehow convinced them over time, at least, to bring my mother adopt her into America. Oh, so she got adopted into a family she had never met before.
Oh my!
She was 15 years old and thrown into Boston public schools. You know what I mean? And you don't get that. You don't give her tools for that transition, but but what you have to survive. And I think it is that. It's almost a cliche in my head now because I say it so much, but it's that immigrant hustle. She made it work. She did what it took to make it work and to survive. People are survivors, right? Yeah. And immigrant hustle is real. And so my mother eventually, went to high school, and then I think she eventually got sick of being with that family. So she moved out when she was 18 or something like that. It's 3 years in. She knew English at that point, of course, but she moved out and became a hairdresser because she just wanted to have her own independence, And then she went on to the medical field herself. But, but no one gives you those tools, right? You just kind of get thrown into it. And so this is the guidebook. This is a way to have some tools, at least, at your disposal.
You need many tools in your
rapid
toolbox.
framework.
Yeah. And thank you for sharing that. That was dope. I also thought when you were saying that, something that Leslie mentions a lot, that I'm not mentioning her because she's off camera, but immigrant hustle comes with immigrant trauma.
Oh,
and how do we deal with that? Because there is a trauma of those transitions and that abruptness. There is the trauma of constantly being in environments where you don't understand what's going on. being put in situations where you're translating for your parents and you're learning things about your parents that you have no business knowing at age 10, but they don't speak English.
Right. So you got to
like,
translate.
Yeah. So you're at the doctor's office learning about your mother's situations, and you're like, bro, what is this? Because you're the translator.
Right.
So there's a lot of trauma that comes with that, and that's why we're so focused on that immigrant community and really teaching the Latino and Haitian community in their languages what this plant is part of our ancestry. So thank you for sharing that, because the immigrant hustle comes with that immigrant trauma, and we got to be able to balance both.
And recognize that it's there. I like
recognize,
that.
acknowledge
it,
process it,
right,
and then really think about what is going to ignite our fire. What is the implementation plan to move away from that trauma? And we always end up back in education.
Right.
Yeah.
I appreciate that.
Yeah.
So as we start to wrap here, any parting words or anything like that? Obviously, we went through your book. Is there anything that you think that you want to give a shout out to, how people can find you, anything like that?
Oh, yeah. I want to first give a shout out to you. Thank you for having me.
Thank you.
I met you at MJ Unpacked in Vegas. It was my first MJ Unpacked, and we were just walking down the hall, and I was like, you're from Massachusetts, aren't you? I was like, so it was thank you for having me. I appreciate it. I want to give a shout out to all of our investors and everybody who's believed in me as I've stepped away. They've been very supportive in their energy and understanding of where my heart is leading me in terms of this space, and allowing me to support Leslie in the ways that I can. I want to give a shout out to my family for and my children in particular, because they have to, as I go through the framework, they've had to live with every new version that emerges.
Right.
So I'm growing up as they're growing up.
Like a cocoon. You're just a new butterfly every
We're
time.
all, yeah. My daughter's I've had 6 different moms in the last 5 years, because mama keeps elevating.
Right.
And now she has new expectations, and she has a new way she does things. I never woke up at 4 a.m. to meditate for 2 hours before, but now I'm up at 4 a.m. to meditate for 2 hours. So it's they're constantly meeting a new me. So teaching them how to transition was a critical parenting tool. So I always say, Rapid is for anyone and everyone who wants to learn how to transition in a way that is thoughtful and that is mindful. And I want to give a shout out to anybody who takes any step towards self-awareness and really understanding themselves and getting to know themselves, because that is going to be very important when you're learning how to use the plant. You really have to just learn how your body responds to the plant.
Slow and low.
Correct. And you first have to learn your body and your body's responses to be able to measure.
Right.
Yeah.
Measurement is everything. Yeah. Wow. I appreciate your time so much, Drudis. Thank you so much for coming on the pod.
Thank you. Thank you for having me. I appreciate it.